KCBS, in partnership with UCSF Health, presents As Prescribed, a weekly conversation with leading medical experts from UCSF Medical Center and UCSF Benioff Children's Hospitals.
Hello and welcome to As Prescribed. I'm Alice Wertz. Medications like Wegovy and similar ones like Ozempic have been trending in the news this year. Originally prescribed for diabetes, people are using these drugs for weight loss. Our guest today is Dr. Diana Thiara. She's an internist at UCSF Health. She's also director of the UCSF Medical Weight Management Program. Thank you so much for joining us again, Dr. Thiara.
Thanks for having me. It's nice to be back.
So this is a really hot topic. Can you tell us, how do these drugs work?
Yeah, so Wegovy and Ozempic are a type of medication called a GLP-1 receptor agonist. And what they do, most importantly, is they work at your pancreas to increase the amount of insulin your body is making. The medications also work on your stomach to decrease gastric emptying. So what that means is food just sits in your stomach longer. And then they also work at the level of your brain to promote this feeling of fullness, or what we call satiety. So you actually feel more mentally full and physically full. And then your body is just able to process blood sugar better because it's making more insulin with the help of these medications.
So what is the difference between these most popular ones?
Yeah, that's a really great question. So Wegovy and Ozempic are brand names for semaglutide. Semaglutide is the same compound. And the difference really is that the FDA has approved semaglutide 2.0, which is Ozempic just for diabetes. And then they've FDA approved a higher dose of semaglutide to 2.4 milligrams called Wegovy. And Wegovy is what's meant for weight management reasons. So they are basically the same medication when you look at the generics. But right now, because they're so new, only the brand names are FDA approved, and insurance companies really go based on what's FDA approved when they think about how they're going to cover medications for people.
So only the one is approved by the FDA for weight loss, Wegovy.
Correct.
I see. So what makes a person eligible or a good candidate for Wegovy?
So the eligibility criteria from the FDA is very simple. It's either having a BMI greater than or equal to 30 or a BMI greater than or equal to 27 with a comorbidity associated with excess weight. So think about things like high blood pressure, high cholesterol, sleep apnea, fatty liver disease. Those are all considered comorbidities of excess weight. But when we think more practically, it's good to look at how the studies were designed. And this is more how insurance companies think about it as well. So insurance companies want patients to also be enrolled in lifestyle change programs. So things like nutrition, activity programs that may be run through a clinic like our weight management program or other spaces like Weight Watchers. And they want to see that patients have been doing it for around 6 months without significant amounts of weight before qualifying for the medications.
Now, what are the benefits, and how long does it take to lose how much? And then let's talk about the risks after that.
Yeah, perfect. So the benefits are, quite straightforward, and it's weight loss and all of the benefits around cardiometabolic health that is associated with weight loss. So in patients who have excess weight, who have BMIs in the obese category, the studies showed around 12.5% body weight loss with Wegovy. You have to remember that Wegovy is a higher dose than Ozempic. So I don't exactly know what would happen if you were on Ozempic, but you would expect lower percentages of weight loss. And so what does that actually mean? For me, weight loss is important because it helps people's other clinical status. So a 12.5% body weight loss, we can see improvements in blood pressure, people actually coming off medications. We can see improvements in blood sugar, so maybe less of a diabetes medication dose needed, reductions in cholesterol, things like that, breathing better, less joint pain. Those are all benefits in the right patient population. Risks associated with the medications are quite straightforward. We see things like nausea and vomiting, and that's because the food is sitting in your stomach longer. We sometimes see other GI side effects, so diarrhea or constipation. Sometimes we see dizziness or lightheadedness, oftentimes associated with the fact that people may not be eating and drinking enough. So those things are common and oftentimes can be worked through if you're checking in with your physician regularly, but not for everybody. And then there's a bucket of serious but rare side effects. So things like pancreatitis or cholecystitis are rare but serious. And also, we do see new or worsening depression and sometimes thoughts of suicidal ideation. We can't predict who that's going to happen to. It's not necessarily someone who has a history of poorly controlled depression or a history of major depressive disorder. It's incredibly rare, but it's important for everyone to weigh that risk-benefit profile as they're thinking about medications for weight loss.
Wow, that's interesting. What are some of your recommendations for folks that are thinking about pursuing this and aren't sure where to start?
Yeah, I think that's a really important question. The main thing first to think about is, are you experiencing sort of side effects or untoward consequences of excess weight? So are you showing signs of impaired glucose tolerance? So something like prediabetes. Do you have high blood pressure? Do your joints hurt because of excess weight? Is there a medical reason for you to lose weight? That's sort of the first question. And if the answer is yes, then it's really important to talk to your doctor about how you can holistically work on weight loss. That includes dietary changes to feed your body good fuel, as well as activity to regularly be moving your body. And once you start working on those things, for some people, that's enough to start the weight loss process. But for other patients, it isn't. And there's a lot of conversation about food noise in people's minds. So they may be trying really hard, meal planning, so on and so forth, but they're just constantly thinking about food. And in some of these patients, medications are super, super helpful. So it's really important to start the conversation and think about how medications fit in based on where you are in your process.
And your recommendation, I would assume, would be to pursue your own personal physician. Is that right? Or are there other areas to look to?
Yeah, so in an ideal world, a medical weight management program would be ideal because we provide comprehensive care for our patients with a physician, a dietitian, and a behavioralist. But that's just not realistic because obesity and overweight are so common, we just can't see everybody. So your primary care provider is a great place to start. They may be able to do some of the work. They may be able to refer you to a nutritionist, or you could seek out some dietary counseling independently through something like Weight Watchers or Noom or calorie tracking using a fitness app. But the primary care provider is definitely your first and best place to go.
Yeah, they're looking at all of your other considerations regarding your health. That makes perfect sense. Thank you so much for joining us today, Dr. Thiara.
My pleasure. Thanks for having me.
Our guest today on As Prescribed has been Dr. Diana Thiara. She's an internist at UCSF Health, as well as director of the Medical Weight Management Program at UCSF. I'm Alice Wertz. Thank you for tuning in to As Prescribed.
As Prescribed, every Thursday at 1:30, right here on the Bay Area's news station, All News 106.9 and AM 740 KCBS, and streaming on the Odyssey app. The proceeding was sponsored by UCSF.